I wanted to start by remembering Saul Garcia. Saul passed away yesterday. Saul was a tremendous leader for our community, and especially our Latinx community, but he was a tremendous citizen for all of Louisville, very proud to show off his hometown whenever he had the opportunity to. He never met a stranger. Anyone that would come to the community that was foreign-born, he would embrace them and welcome them, and of course had a special spot in his heart for our Latino community as well. He was a strong backer of education, of public safety. If you needed anything, Saul was there. And so he lost a long battle with cancer yesterday, and I thought it was particularly appropriate here today as we celebrate our foreign-born community and our Latino community, that this is something Saul Garcia would have been right in the middle of. And he's just a good man for the entire community. So let's just take a moment of silence and remember Saul and give our thanks to him. Okay, bueno. Rest in peace, Saul. Well, welcome back to Broadbent. There's just been incredible work taking place here over the last 5 or 6 weeks. You can see each time as the media comes, just more and more people coming through here. We set a record for a single day this week that Dr. Hartledge will be telling us about. But again, I want to just say our public health team's been doing a fantastic job. Our volunteers have been incredible. The number of people that have been wanting to step up to continue to help on this has been awesome as well. And you know, it's just, how do you solve a big problem? You do it one person at a time, one shot at a time, and we're making all kinds of progress. We probably have now, 14% of the community, I assume, is vaccinated. So, you know, we're well on our way. That, in no small part, is happening because of the great partnership we have with our state government. Governor Beshear and Dr. Stack and Secretary Gray are working really hard to get as many vaccine doses as possible to us. We appreciate their work. We appreciate what the Biden administration is doing as well. Our federal partners here in his first month on the job increased federal supplies some 25% in the past month, and that is really going to help us as we see significantly enhanced vaccine supply in our community some 6 or 7 weeks from now as well. So we got to get more shots because we have a lot more demand than we have supply. And we need to make sure that we get as many people vaccinated as possible, right? So we get to that herd immunity that we want. And Dr. Fauci has said we need as many as 85% of our people to defeat this virus. So we know what we need to do, but we have some challenges that we need to work through. And one of them is what we call vaccine hesitancy. In a poll released by the Associated Press last week, it said about 33% of Americans do not plan to get vaccinated. So you can do the math. 100 minus 33 is 67%, and we need to get to 85% for herd immunity. So that means we got a lot of work to do to overcome skepticism and suspicion and distrust that exists regarding vacancies, sometimes particularly in our black and brown communities. And this hesitancy is historically understandable and could likely cost lives. So naturally, we need to do everything we can to prevent that. So we're working to ease those concerns and ensure equitable distribution through the work of our Vaccine Distribution Task Force, and equitably administering the vaccines is a top priority and an ongoing effort for my office, and it is, as you'll hear from Governor Beshear, as well. So today, as part of that work, we're focused on the importance of vaccinating the members of our international community. Our city's immigrant community, our foreign-born community, has been awesome. They have fueled our city's growth. They have fueled the spirit of our community. They have fueled the culture of our community as well. And you've heard me saying that for 10 years, and you're going to hear me saying that for the rest of my life. And I really appreciate our international community, and I want all of our residents in the world to know that Louisville is a welcoming, compassionate, and proudly diverse city. The only thing I ask of our foreign-born residents is one thing, and that is to make sure that you ask your brothers and sisters and tias and tios to move to Louisville as well, okay, so we can grow even faster with our global community. So we've been working with specific community and media partners since the beginning of this pandemic, sharing messages about the virus and testing options in 26 different languages. And today, we're proud to welcome some of our community partners here to LouVax to help us demonstrate that vaccines are safe, scientifically proven, reliable, and they are the best way to keep us safe, our families safe, and reopen the economy. And here to help us spread that message is a special guest. He was here a couple weeks ago and experienced the great work taking place here at Broadbent. Governor Beshear has been, if not the top governor in the country, amongst the leading governors in the country to really do the right thing as it relates to helping our people and saving our people and protecting the health of Kentuckians from COVID-19. So, Governor, we really appreciate you for standing up and standing strong for health, for science, and for compassion during this incredibly challenging time. You make all of us proud. Please welcome Governor Andy Beshear.
Well, I want to thank Mayor Fisher, and it is so exciting to be back here today. Being in this building, seeing what is behind us is a moving experience. It's really hard to put it into words. You see compassion, you see hope, you even see victory. This is a really special place, filled with really special people that are coming together to get us to the other side of the greatest challenge that we have faced in our lifetimes. And just being here lifts you up, helps you breathe in, gets you ready to fight that next day, and lets us absolutely know that we are going to get through this. We are going to make it to the other side. We are going to defeat COVID-19. Today, we are marking another important day, an exciting goal in our COVID-19 vaccination program. We were here just 3 weeks ago to celebrate our progress in vaccinating our educators. And I am more optimistic than ever about our progress to vaccinate all Kentuckians, to save lives, and to finally defeat this evil virus. Yesterday alone, we announced more than 150 vaccination sites, including 6 new regional sites across the Commonwealth, some mobile clinics, 10 Kroger stores, 15 Walmart stores, and 125 pharmacies spanning the breadth of Kentucky. And there is more to come as we work to bring these miracles of modern medicine to our people wherever they are, in their communities, in places that they feel comfortable. Norton, for instance, is partnering with the state and with the city, launching clinics to reach at-risk, underserved individuals ages 70 and older at St. Stephen Baptist Church and Bates Memorial Baptist Church. And today, we are here on Louisville International Community Vaccination Day as we prioritize making sure these life-saving vaccines reach everybody in a fair and equitable way. It's not just a value, it is an absolute requirement from this Commonwealth in how we distribute these vaccines. And we need to be transparent, and we need to be clear that we have not lived up to our value fully yet. But we are committed, we are intentional, we are going to rectify it as we go, and we are going to ensure that so many in our underserved population get this shot of hope and are able to spread the word to others in their community. Everyone here today is helping to make sure that every person in our Commonwealth knows that they are a part of Team Kentucky, that they matter, and we want them to get this life-saving vaccination. You are highlighting a lesson that has never been more important. No matter what we look like and no matter where we are from, we are all Kentuckians. We are all connected and we all need one another. This pandemic didn't create the inequities we see in our society, but they have laid them bare in some of the starkest terms imaginable. This has been particularly plain in the outside impact of COVID-19 on minority populations and other underserved communities. This is a pain and a legacy of harm that I know I can never truly feel, that I can never truly understand. But my commitment is always to listen, to try to hear, and then to act to address those injustices that have been committed for so long. As Dr. King reminds us, the time is always right to do what's right. And what's right now is to make sure that there is a shot of hope available to all of our citizens. For weeks now, our only issue in terms of the number of people vaccinated has been supply, supply, and supply. For the last 5 weeks, we have vaccinated more people than we've gotten first doses from the federal government to do so, meaning we already have the apparatus in place to vaccinate 100% of people for which we get doses each week. And in fact, we believe we could do more than 250,000 vaccinations a week if given the supply. We've shown we can do it quickly and efficiently, and we are working right now to build out our network statewide to ensure that when that additional supply comes, and we got a little bit of really good news yesterday on that, believing that there's going to be a significant increase in March and into April, that we can get it all out immediately. That a large supply coming at one time doesn't mean it takes us weeks. It should take us a week to be able to get in people's arms. Right now, the vaccine appointments are limited due to limited supplies. Kentuckians in Phase 1B, people ages 70 or older, are currently eligible for the vaccines. We're asking all vaccine sites to prioritize this group, and we are making good progress, and I think we are getting very close to being able to open up to 1C. We also ask every single site, this one and others, to make sure that you get 90% of all of the supply you get in a week in somebody's arm during that week. But I can tell you this site and everybody else are hitting 100% week after week, and they've done so since January the 5th. We've also launched a new website, vaccine.ky.gov, and a hotline, 855-598-2246. And for the deaf and hard of hearing community, and only that community, please don't flood this line if you don't need it, 855-326-4654. These resources are available to help people know when they qualify and where their closest site is. Until the supplies increase, we need to ask people to be patient. And that's really hard. Everybody's scared, everybody's anxious, everybody wants to get back to hugging their parents, and my parents want to get back to hugging their grandkids. We all want to be through this so quickly, but we got to continue to sacrifice knowing that everybody around us is counting on us, that our decisions right now, whether that is wearing a mask or whether it is showing a good example of being patient for the vaccine, knowing it's coming for everybody, is so important. We're going to get there. And how we act in the example that we set until we get there is going to determine the orderly fashion of vaccines, but also us bringing along everybody with us, us not losing another person that we don't have to. Because I don't know about you, but announcing 35, 40, or 50 deaths a day is heartbreaking. It is absolutely heartbreaking. What we see behind us is one half of the piece to stopping that. The other is masking up, continuing to social distance. If you have been vaccinated, we need you to continue to do all of those things to protect the people around you. And finally, it is vitally important that these vaccines go out in a fair and equitable way. If you want a vaccine, you should be able to get one. We also know that the color of your skin or the size of your bank account should never matter when it comes to being able to get an appointment for one of these vaccines. We have a historic obligation to meet this moment. Let's make sure we meet it in a way that doesn't continue injustices that we have seen for far too long. That in this life-saving, historic moment where we defeat a virus, that we can be better in terms of systematic racism, in terms of inclusion or those that have been left out. Let's make sure this major moment of our lifetime, this historic moment, is one where we truly do it right, is one where we get it right, and maybe that can set an example for so many other things we face. I want to finally just thank everybody that's here. Thank you all for getting that word out, for being willing to get your shot of hope, but then going from here to talk to other people to make sure they get it. Thank you to all these volunteers who are here working so hard to create one of the most efficient, effective vaccination sites in the entire country. Kentucky is proud of what's been created right here. Thank you to the media for getting the word out about where people go and what they need to continue to do to mask up and to protect one another. We are so close. And by so close, yes, it means months, but we are so close. And after living through everything we have, after the fight that we have had to put up, let's make sure we do this right for the coming months. And let's make sure we do this right in how we get these vaccines out. Thank you all very much.
All right, thank you, Governor. We appreciate you coming and showcasing all the good work taking place here at Broadbent. And that good work would not be happening were it not for the great work of our Department of Public Health and Wellness, led by Dr. Sarah Moyer and Dr. Sarah Beth Hartledge here, who's overseeing this site. She's our Associate Medical Director for Louisville Metro Public Health and Wellness and leader of our vaccination efforts, doing a wonderful job. She will give us an update on our vaccinations and recognize some of our great volunteers. Dr. Hartledge.
So I'm going to begin with some stats to update the progress of our vaccination efforts. Across the metro area, including this site at our hospital partners, 114,688 total doses have been given. That includes about 86,000 primaries and about 28,000 boosters, which means there are 28,642 members of our community who have completed the entire shot series. Here at LouVax, we've given 27,181 total doses, including 24,902 first doses. And that number, we're proud to say, includes about 16,000 educators from both our public and private schools. As the governor mentioned, we are tasked with giving out at least 90% of the doses we receive within a 7-day period. I'm proud to say that this site exceeds that regularly. Last week, our percentage was 134%. And we've averaged over 100% every week since opening. On Monday, we had a big day. Our previous record for the fastest hour was 178 patients in an hour. On Monday, 7 of our operating hours would have broken this record, and our new fastest hour is 323. Our previous biggest day was 1,589 patients, and on Monday, we served 2,104. I'd especially like to thank the volunteers who stayed and staff who stayed a little bit late to help accomplish that record. When we made an announcement that we were not going to turn anyone away even after closing time, we were going to stay until the work was done. Nobody got up and left, so thank you to everybody who stayed to get that done. In the coming days and weeks, we are serving some other groups here. We have NTI Hub staff, so they are also considered educators coming through. Some of them are here today and next week as well. And then we are also serving adults age 70 and up, which is a major component of Tier 1B, and our hospital partners continue to serve those folks as well. Although we're looking toward Group 1C and beginning to make those plans, we continue to collaborate with our healthcare partners to get those adults 70 and up vaccinated as quickly as possible, in particular acknowledgement of the risk of serious illness, hospitalization, or death that those people face if they are infected with COVID-19. Appointments for that population remain available for direct sign-up via U of L, Baptist, and Norton. There's also an expansion to Walgreens that is now available. There continues to be a wait list available at Norton, and those on the wait list will receive emails to schedule an appointment as soon as those appointments become available. All this information is available on our website at louisvilleky.gov/vaccine. Today is International Friday here at LouVax, and we are happy to say that we have 100 patients representing 28 countries and 23 languages. and we wanted to make sure that our community knows that we can provide translation services here at any time for those who English is not their primary language. Our paperwork forms are available in a number of different languages, and our electronic portal will soon be available in translation as well. As I've said several times, the volunteers are the heart and soul of this operation. So some stats on our volunteers: we have over 5,000 that have registered and over 2,000 who have participated on the site. The total number of hours served through Wednesday is 37,219. We have 368 volunteers who have worked over 40 hours and been vaccinated for their service. Our volunteers of the week this week are behind me, and I'd like to recognize first Dr. Ryan Combs, who's on the staff at the School of Public Health and is also our most enthusiastic traffic director at LouVax. I also have Catherine Nelson, who is one of 2 volunteers who have logged over 100 hours on the site. I have Tricia Siegelstein, and she has the distinction of having worked in all 3 of our zones this week, so indoors and outdoors. And then continuing with our family theme, we have a married couple here who have received their vaccination and continue to come back and help others get theirs as well. So Steve and Donna Kendra. In addition to the hundreds of volunteers, we have 69 Metro staff from 21 different agencies working on the project at least part-time, including some off-site helping with data entry and things like that. So we do want to recognize a staff member of the week. And this one comes to me, I received an email about this staff member, and the way they described her, they said she treated everyone so kindly, never failing to keep the lines moving. She was helping all the other staff members whenever I saw her. Carrie and other employees warm my heart and remind me that there are so many great people in this city that I love. So thank you to Carrie Christie, who staffs our volunteer reception desk every day. If you've been to LouVax as a patient or a volunteer and someone stands out to you, please let us know so that we can recognize them for their service as well. I have just a couple of quick general COVID updates I'm going to share before I hand it off. A lot of talk recently about variants, and just a reminder that it's normal for viruses to mutate. That happens all the time. There are several variants circulating worldwide, and the so-called UK variant, also known as B.1.1.7, has been identified in Jefferson County. To date, we have only 1 case. This variant is more transmissible than other forms of the virus, so although it's not inherently more deadly, a more transmissible virus leads to more cases, which can lead to more hospitalizations and more deaths overall. The good news is that all available data suggests that the vaccines we have are effective against the variants, in particular the UK variant or B.1.1.7. And remember that our other mitigation efforts also work against the variants: social distancing, hand hygiene, and masks. Contact tracing and disease investigation remains very important, so please answer the phone if you receive the call. And then finally, to address masks, there have been some updates from the CDC in the last week where people are asking about double masking. And the most important thing to know here is that it's more important for you to wear a single, well-fitted mask than to worry about wearing 2. So you want to make sure it fits tightly across your nose. There's no gap on the side. You can tie knots in the ear loops to help with fitting. If you choose to wear a double mask, it's recommended that you pair 1 disposable mask like this one with a cloth mask rather than 2 disposables or 2 cloth masks together. I think that's it. Okay, and I'm going to hand it back to the mayor. That's all I have.
All right, thank you, Dr. Hartledge. Again, wonderful job to you and all the volunteers here. Okay, on to the main event here. To introduce our friends from Louisville's international community, I'm proud to welcome Sabine Nassim. Sabine is our director from our Metro Office for Globalization. One of the things that's really important to us is that we take Louisville to the world and that the world comes to Louisville. and that's throughout my administration, but highlighted in our Office for Globalization. And so Sabine and her team have been working closely with Metro Public Health and Wellness to ensure that every Louisvillian has access to life-saving health information and services, particularly during this pandemic. So Sabine, you're doing an awesome job, to you and your team, so really appreciate that. Please welcome Sabine Nassim.
Thank you. Thank you, Mayor. Good morning. So as the Mayor mentioned, our federal and state partners are working hard to get us as many COVID-19 vaccine doses as possible. And while these efforts to administer the vaccine are ramping up, it's equally important to consider how to prevent disparities and ensure equitable access, especially since there is a dramatic rise in misinformation that's being shared, and there continues to be a lack of trust among our Black and brown communities. As a result, many families are hesitant to receive the vaccine, and this is especially true in many of our immigrant communities. Since day one of the pandemic, targeted efforts to reach immigrant and refugee populations have been a priority for the Office for Globalization, minimizing access barriers by ensuring all individuals have access to accurate information in a language they can understand, from trusted immigrant community ambassadors that are providing their voice publicly so that our global communities are better informed about COVID-19 and the vaccination, so that they are more comfortable with receiving the vaccine. As such, it is with great pleasure that I would like to introduce 4 immigrant community leaders who will receive their first dose of the vaccine today because of their connection within the immigrant community and because of their leadership, influence, and voice that will help lift our efforts in communicating to segments of our community that face potential barriers to obtaining the vaccine. Mr. Farhan Abdi. Farhan was born in Somalia and has been in Louisville since 2008. He is the executive director for the Somali community of Louisville and serves as a successful immigrant community leader that has a passion to build and empower collaborative partnerships to advance the mission of his organization. You may recognize Farhan in the Stay Strong Louisville campaign. Next to Farhan is Dr. Patty Bautista. Dr. Patty was born and raised in Mexico City, where she studied medicine at the School of Medicine, National and Autonomous University of Mexico. She moved to Louisville 27 years ago and attained a master's in public health in health promotion and behavioral sciences from the University of Louisville. She now works as a community liaison in health promotion at La Casita Center and is a valued member of our immigrant community. Next to Dr. Bautista is Ms. Hallie Karimi. Hallie was born in Iran and has been in Louisville since 1996. She works at U of L College of Business. She is a highly well-respected Muslim woman and community influencer who has been volunteering her efforts for the COVID-19 Multicultural Community Campaign. And there at the tail end, Mr. Kevin Yusenga. Kevin was born and raised in Rwanda, East Africa, and has been in Louisville since 2007. He founded Sea Forward Ministries and currently serves as its executive director, leading efforts in the African immigrant community as a well-respected influencer, sharing resources and nurturing partnerships.
This is one of the greatest opportunities for us to be to have this vaccination. So we want to be taking advantage of this just for the sake of our health, for the loved ones, for our family, our mothers, our daughters, our sons, everybody that we live with. And just like a son of a nurse myself, I know that this is going to be very exhausting to the nurses, the doctors, everybody out there in public health, just who have been fighting this since early last year. So let's just give them a break. Please come and take this vaccination because it's about time we move on, we get back to our normal life. We worship God in a way that we should be worshiping our God, and we hang out with our family and friends. Just let's take advantage of this COVID-19 vaccine. It's the greatest miracle. Come on and get this vaccine. It's not a big problem.